Welcome to the local coordinating council meeting. I'm Angel Bond and I'll be facilitating today. This is our second virtual meeting that we've done with the LCC. So I'm hoping that you guys can provide some feedback on how it should go differently to really make it useful, like during this time when we don't necessarily have that in-person contact. So I sent out some information before this on how to access the meeting prior, but I will just go ahead and go over a couple of reminders that you can access this meeting through Microsoft Teams or in your browser. This is what I had said in the sheet that I sent out just prior to the meeting. You can join in the browser instead. And you can also call in just by clicking it. So if you have problems during the meeting, if you get kicked off or something, you can go ahead and call in on your cell phone. The meeting invite has all the call-in information under notes or under details of the meeting. And then just go over a couple of the functions of Teams, because I know that not everybody is as used to Teams as they are with Zoom or one of the Google Hangouts or something like that. So video does help with communication. You don't have to use your video if you don't want, but this is how you show up if you do use your video. You are going to be muted unless you're speaking, just that way it cuts down on some of those echoes that we get. Also, there's a chat function. So if you have any comments or any links that you want to share, go ahead and click on the chat function, and then you can enter it in the side panel here. Also, you can see who else is on the call by clicking on the person icon, and it will bring up the list of people who are in the call. And this meeting is being recorded to help us with minutes. I did record last month's meeting and I wasn't able to share it externally. I thought that with Microsoft Teams, I would be able to send you guys a link if you wanted to rewatch it, but we have it's only available to internal people through a video. So we'll just use these videos for us to take notes for the meeting and send them out to you all. So just a reminder, we alternate meeting locations, typically speaking. We will be doing virtual meetings due to COVID-19 until the situation is safe to gather in person, but we do alternate between Longmont and Boulder to kind of get some geographic equity there. And the purpose of this meeting is to really bridge the gap between transportation and housing and human services. So we really want to give people options, multimodal transportation options, to get them to the safe and thriving area. We find that people are perhaps stable in their transportation options until something critical happens, and then they have to find other transportation modes. So really, transportation is essential to accessing all other aspects of your life. And so we really do want to look at that intersectionality of transportation and the human services. So today's meeting, we're going to be going through introductions, and we'll try to keep those pretty simple this week or this month. I know last month we did longer introductions. We'll also do some meeting member updates. And then we have 3 presentations. We have a presentation from Jocelyn Fankhauser from Boulder County Housing and Human Services COVID response. We also have Dr. Cog, who's going to be giving us an update on their coordinated public transit human services transportation plan. And also we have the city of Louisville is going to be giving us an update on their transportation master plan. So I think we have a pretty full agenda today. And if you have any comments that you are not able to make with audio, you can go ahead and put those in that chat function during. But we're going to go ahead and go through with introductions now. You can go ahead and unmute yourself and say your name and organization. And to cut down on some of that popcorning, people talking over each other, I will go through the list and just call you to unmute yourself. So we'll go ahead and start with Aaron. Aaron, could you please unmute yourself?
Yes, my name is Aaron. I work for Center for People with Disabilities in Boulder. Thank you.
Thank you. Okay, next, Ann Bartels.
Hi, this is Ann with Pasco. I work with Pasco and Community Outreach.
Okay. Ashley, next. I have Ashley Garcia Perez. Are you able to unmute yourself, Ashley? Okay, we'll come back to Ashley. Next, I have Eden Bailey. Can you unmute yourself and introduce yourself?
Hi, this is Eden Bailey. I'm with Boulder Adult Services with the City of Boulder.
Okay, wonderful. Okay, next I have Anna Colon. Can you unmute yourself?
Sorry. I am with the outreach and engagements, or I'm the outreach and engagement specialist for Mobility for All.
So Anna's our new Daniela, so she's helping out Mobility for All. Today's our first day. Next we have Ben Ortiz. Will you unmute yourself and introduce yourself? Okay. We'll go ahead and skip to Bill Sweeney. Would you like to unmute yourself and introduce yourself?
Sure, I think I'm unmuted. This is Bill. I work with the Bridge House.
Okay, welcome, Bill. Ben Ortiz, do you want to introduce yourself again? Try to unmute yourself.
Angel, this is Leslie. It looks like he wrote a note that says he has no mic.
Oh, wonderful. So Ben Ortiz is with Longmont Transportation. So next we have Brandon. Would you unmute yourself and introduce yourself?
Hello, everyone. My name is Brandon Stepter. I am a community liaison with Colorado Community Health Alliance.
Great, welcome. Next we have Christina. Christina, can you?
Hi, Christina Zazueta with Community Engagement RTD.
Great, welcome. Next we have Claire Gomba from CDOT.
Yep, hi, this is Claire Gomba with CDOT Division of Transit and Rail.
Welcome.
Thanks.
Next we have Dinah.
Hi there, sorry, took me a second.
Oh, no.
This is Dinah Pollard with Lafayette Senior Services. I'm the resource specialist there.
Wonderful, welcome. Next we have Elaine.
With Boulder Transportation Connections.
Welcome. Jocelyn, you're next.
Hi, I'm Jocelyn Fankhauser. I'm with Boulder County Housing and Human Services, and I'm the emergency coordinator.
Wonderful, thank you for joining us today. Next we have Gabby.
Hi, my name is Gabby Weinberg, and I'm an advocate at the ACL.
Welcome. Next we have Whitney.
Hi, everyone. This is Whitney Wilcox. I'm a program coordinator with Boulder County Housing and Human Services.
Great, welcome. Next we have Whitney Garcia.
Hi, I'm also Whitney. I'm with City of Boulder Older Adult Services.
Welcome.
Thanks.
Next we have Leslie.
Hi, Leslie Gibson, Boulder County Housing Authority.
Thank you for joining us. Paul.
Paul Hamilton, Senior Manager of Paratransit Services, RTD.
Welcome, Paul. Thank you for joining us today. Next, we have Natalie.
Hi there, this is Natalie with RTD Service Development.
Thank you for joining us. Next, we have Jeff. Jeff Becker, do you want to unmute yourself? Okay, we'll go ahead and come back to Jeff. How about Jen? Jen Shriver? Okay. Jeff Becker? Okay, so Jeff Becker is from RTD and Jen Shriver is from, oh, Jen, I see you unmuting yourself.
Oh my gosh. Wow. Thank you. Okay, do you want your burrito? Oh, no.
Okay, so I believe that Jen Shriver is from Community Cycles. So we're getting some interference there. So next is Juliet. Would you be able to unmute yourself?
Sure. Good afternoon. My name is Juliet Woodson. I'm with the City of Lafayette Public Works.
Thank you for joining us, Juliet. Next, we have Joni.
Hi, this is Joni Lynch with the Our Center in Longmont. I'm the Family Resource Manager there. Thanks.
Thanks for joining us. Next, we have Katie B. Katie, can you unmute yourself and introduce yourself?
Whoops, sorry about that. Can you hear me now?
Yeah, we can.
Okay, it's Katie Beasley from the City of Louisville Senior Services at the Recreation and Senior Center.
Great, thank you for joining us today. Next, we have Lisa Curtis.
Hi, this is Lisa Curtis with VIA Mobility Services, and I'm the Director of Development and Community Outreach. Thanks.
Glad you could make it, Lisa. Next, we have Lisa Hode.
Hi, everybody. I'm Lisa Hood with Dr. Cog, Public Engagement.
Great, thank you. Sorry I mispronounced your name, Lisa.
No worries.
Next, we have Maggie. Maggie, can you unmute?
Yep. Hi, everyone. It's Maggie Lee, Director of Programs with Mile High Connects.
Welcome to the call. Next, we have Malia Munson.
Hi, this is Malia. I work with the Denver Regional Mobility and Access Council, also known as Dr. Mac.
Thank you for joining us today. Next, we have Matt Helfant.
Good afternoon, Matthew Helfant, Senior Transportation Planner at Dr. Cog.
Thanks for joining us. Next, we have Megan Davis.
Hi, this is Megan Davis with the City of Louisville. I'm in the City Manager's office.
Thank you for joining us.
Thank you.
Next, we have Megan. Megan, can you unmute yourself? Oh, sorry, the other Megan. Megan.
Kalachek. Hi there, I'm Megan Kalachek with Z-Trip.
Thanks for joining us, Megan. Michelle Waite.
Michelle Waite, City of Longmont Senior Services.
Thanks for joining us. Next, we have Jacqueline.
Hi, everyone. I'm Jacqueline Myers. I go by Jackie, but I'm with Older Adult Services with the City of Boulder.
Welcome, Jackie. Next, we have Danny O'Connor.
Hey, good afternoon. Danny O'Connor, City of Boulder Transit Program Manager.
Great, welcome.
Good to see you.
Next, we have Lindsay.
Hi, this is Lindsay Parsons, Aging Policy Advocate and Planner with the Boulder County Area Agency on Aging.
Great, thank you. Sandy Stewart.
I'm Sandy Stewart, and I'm with the Transportation Advisory Board with the City of Longmont.
Welcome, Sandy. Next, we have Rebecca.
Hi, I'm Rebecca Seiden with Boulder County Housing and Human Services Impact Division. I'm the Mill Levy Program Coordinator.
Welcome, Rebecca. Sue Brandt. Sue, can you unmute yourself and introduce yourself? Okay, so Sue Prance with Community Cycles. She's the executive director there. Next, Tammy Winston.
Hi, I'm Tammy Winston. I'm representing the Peak Ride Planning Group, and we're putting together a volunteer driver program for older adults and persons with disabilities in the mountains of Boulder County.
Great, welcome, Tammy. Next, Tim Beal.
Hi, Tim Beal from Boulder Housing Partners.
Welcome, Tim.
Thanks.
So we have a few more. We have about 6 people who are on their cell phones. So if you just want to unmute yourself and introduce yourself, we might have some over talking, but it's fine at this point.
Lisa Bitzer with Via Mobility Services.
Hey, Lisa. Anybody else on the phone want to unmute yourself?
Jamie Lewis from the Colorado Cross Disability Coalition.
Thanks for joining us, Jamie.
You're welcome, Andrew.
And this is also Anna Stewart from Boulder Valley School District.
Hi, Anna. Thanks for joining us. Okay, so if anybody else wasn't called, go ahead and either tap your introduction into the chat function so that we can account for who attended and follow up with you afterwards. As you can see, we have a pretty full house today. We have about 50 people on the call, which is pretty good, much more than what we normally get when we're in person. So I guess there's some perks of doing remote. So today we have a pretty full agenda, as I said. If you have questions, I'll try to pay attention to the chat function. If I can't get to it, perhaps Lisa Gibson or Anna Colon, you guys can just chime in and let me know that there's something to address in the chat. So these are the member updates that we're going to be going over today. So starting out with RTD. Natalie, I know you have another meeting that's coming, so we put you at the front. So if you want to unmute yourself and give the RTD update, that'd be great.
Hi, everyone. I think I'm going to keep it short and just keep it to the bus operations part because we also have others on the line that might be able to give additional information. Let me double check on, I think Paul Hamilton was on, and then Christina's on, and Jeff Becker on. So they might also want to add. I just think everybody knows at this point that we changed our service levels on April 19th due to the ridership drop because of the COVID-19 situation. Basically, what we're providing currently is about 40% of our regular weekday service levels. We've implemented a whole bunch of measures externally and internally. And again, others might be able to chime in on that more specifically. I also had to send you that informational sheet with all the items. And if you want to go ahead and just send that out to the group, please feel free to do so. The other thing I also want to mention is that tonight, because in this area, we have a telephone town hall with Director Lubo from 6 to 7. I'll go ahead and put the link to that in the chat as well. So anybody who wants to call in or listen in at that time, you can definitely get a whole bunch of more information about the current situation at that time as well.
Great, thank you. And how have those town halls been going, Natalie? I know that that there's been quite a few others.
Yeah, I only have had one with Director Geisinger. It went quite well. It was good participation and good questions. And yes, the main concern is, safety on the vehicles and the mask wearing requirements, because throughout the district, there are different rules and regulations depending on which community you're in. So there was some confusion there. But I think in general, the town halls have gone quite well, and it's been quite informative for everybody.
Great. Definitely try to attend the one that is tonight. Thank you. Paul, do you want to give an update on paratransit since you're on the call? I know it was kind of I don't want to like just spur of the moment call on you if you weren't prepared, but I want to give you the opportunity since you're on the call anyway. Okay. Okay, so I don't see Paul chiming in, so we'll go ahead and move on unless anybody has any other questions for RTD. I do want to point out that Natalie's email address, I accidentally cut off the M at the end, so it is .com. So if anybody has any questions for Natalie or any of the other RTD representatives, you can go ahead and put it in the chat function now. And I do see that Jennifer from Community Cycles did introduce herself in the chat function after. She wasn't able to unmute herself. Okay. So if there's no questions for RTD, we'll go ahead and move on. So next we'll go ahead and do a Z-Trip update. So Megan, do you want to unmute yourself and give a Z-Trip update?
Hi, everybody. Yes, I'll give a quick update of kind of what our whirlwind has been for the last couple of months. So start with with reference to COVID-19, starting in March, our drivers became required to clean our vehicles between each and every trip, on top of regularly using hand sanitizer. And then in April, we did start requiring all of our drivers to wear masks, and we did stop sharing rides. So at certain times, like there would be potentially more than one passenger in the vehicle, and unless they actually are family members that live in the same household, we are no longer letting passengers share rides as of April. And then we also began fogging our vehicles as well at that point, weekly and as needed, with sanitizer. And then with the stay-at-home regulations, we had a very large drop in rides, but we have seen actually a very, very strong increase now at the beginning of May with quite a few rides people are taking. I would have to say that with our more intense cleaning practices, it is taking us longer to get to passengers because of that. And we are also having our call centers reminding passengers who are booking trips to wear masks. So that's kind of some of the stuff that we are doing at this time. We have had, additionally, because of everything, we have had a drop in drivers, people that need to stay home with their kids and other things at this time. So if there's anybody out there that knows people that maybe are in a different industry and are looking for work, we are looking for additional drivers during this time that would like to help within the community. So.
Great, thank you. So which regulatory agency do you all have to follow? I mean, I know that the Safer at Home is CDPHE, but is there the PUC who's really giving you all guidance, or who's giving you guys guidance on what you need to do?
So actually, I have been in contact with the PUC, which really is not in our conversations, formal, informal from the PUC. They are not regulating necessarily the safety portion involving in the health stuff. That would be, we're not necessarily regulated by that, but we're following the counties, the cities, and the state's regulations as best as possible. Additionally, we do have certain accounts that have very specific designations that they would like us to follow, and that's what we're doing. We're doing whatever we can, and we're also very open for ideas and suggestions, and definitely a lot of bobbing and weaving the last couple of weeks to months, just trying to learn new rules that we think are potentially best practices, and they might not be the best practices in a couple of weeks. I don't know, but we're just trying to do our best to keep both our drivers safe and our passengers safe, because we definitely provide quite a bit of transportation to people that really still need it no matter what. We've got our regular dialysis patients and stuff like that that really do need to get where they need to go. So.
Okay. Great. And so with the IntelliRide referrals, have you been getting more or less IntelliRide referrals for the Medicaid trips?
We have had less trips overall. I believe some medical things, especially with the stay-at-home practices, a lot of trips were canceled unless they were deemed necessary. That might be starting to change here this month as more facilities are opening for stuff like dentist appointments and that sort of thing, or non-emergency procedures. So we may see a little bit more because of that. But some of our other passengers are not going for medical appointments as often as they normally would go. So,
okay. Great. Well, thank you. Does anybody have any questions for Megan regarding Z-Trip?
This is Michelle. My question's in the chat also, but Megan, will Z-Trip take a person with suspected symptoms to a testing site? We've had 3 requests for this.
Yes, we will. And honestly, at this point, we have to treat every passenger in our vehicles as potentially having the virus. So we have to treat everyone the same. I do have to say that we do have one vehicle that we have created that we have converted to have a plastic separator between the front of the vehicle and where the passenger would sit in the back of the vehicle, that we have offered to some of the hospitals around, that if they do have confirmed or suspected like that they would like transferred, we can use this specific vehicle. With that, we will spray it with our fogger before and after. So there is some additional costs with that because of the additional ride time between sites. So if somebody's requesting something like that, we can do that. And I can, I have a flyer that I can send to Angel that she can send to the group afterwards if anyone's interested in learning more about that specific service that we're offering.
That would be great, Megan. And they will do the whole drive-through at a testing site, correct?
Yes. And then we would be using the wait time at that point. I did want to make note that I have requested or asked, and Michelle, you kind of reminded me, with the non-medical Medicaid trips, we have asked a few times for the state of Colorado if they would be willing to allow passengers that have the non-Medicaid medical trips to use that for grocery delivery or pharmacy delivery. But at this time, the state of Colorado is still requiring us to have a passenger on board to transport to do those non-medical trips. But I really wish that there could be something like that could come up that would allow us to get things for people without actually having them have to leave the home.
And who are you working with, Megan? You're working with Healthcare Policy and Finance, I'm assuming?
Yes.
Okay. So I can send an email, not that, I'm any more influential than you, but I can, through our chains, we can also reach out to them and see if there's anything on the horizon for a policy change.
Yeah, they definitely said it's in discussion. And this is something that I requested, I want to say, initially brought up and called and emailed them March 16th on this. I just really see that as a potential awesome opportunity for passengers that would be more at risk to be able to stay home and still get their essentials. So,
yeah. Okay, wonderful. So I will reach out to because I have been in discussions with CDOT and just talking about these challenging gaps that we're seeing. And so, just basically talking about how we need to have more cross-agency discussions regarding these transportation barriers under COVID. In particular, it was, and I guess maybe this is a good transition point to Brandon, who is with CCHA, but we've been having a hard time, or they've been having a hard time identifying providers that are willing to transport people who are suspected of positive COVID. But I'll give you one last opportunity to give any other updates or questions before I move on to Brandon, because he is going to. Yeah.
This is Michelle. I'm sorry. I have one more question for Megan.
Oh, yeah.
Would you be willing to bill us for a rider who didn't have the funds if we authorize that? And I can email you directly and work that out, but is that something you would consider?
Very much so. That's
okay.
Super easy for us to set up and do.
Okay. I'll email you separate, Megan. Okay.
And Megan, as far as pricing on that, you did say that it was more expensive. Do you have a price amount that you're charging for that?
Yes, it is. It is actually what our PUC regulated cleaning fee is. So it's a $50 cleaning fee on either side to have the vehicle completely cleaned prior to somebody getting in it and completely cleaned afterwards. So.
And that's in addition to the regular cost of the trip?
Metered rate. Yep, the regular metered rate.
Okay. So, I mean, that is quite pricey, but it's better than like what we've had. We haven't had very many options in the past. So any other questions for Megan before we move on to Colorado Community Health Alliance? Okay. If you have questions that come after the fact, you can put it in the chat, and then I'll do my best to forward the questions on to Megan, because I know she does have a board meeting right now that she's supposed to be attending. So thank you, Megan, for taking time out of your busy schedule, and we'll move on.
Thank you very much.
Okay. Next, Brandon, if you want to unmute yourself and give the CCHA update, that would be appreciated.
Awesome. Hi, everyone. Super quick update. Just wanted to let everyone know kind of where we are at as the Ray. So a few weeks ago now, the call kind of went out for entities who we were working with to figure out how we could transport particularly the homeless individuals who may be suspected of being positive of COVID-19 or who might have been presumed to have been exposed to COVID-19 to get transportation from their primary care doctors or testing site to a shelter that is also housing folks who might also be suspected to have an exposure or positive to COVID-19. Not a whole lot of movement has been made. We have been able to identify some kind of more independent providers who are still accepting that kind of service. And I definitely will be reaching out to Megan to talk a little bit more about that. So maybe next time I'll have a little bit more of an expansive update, because that is definitely an area we might be able to have some influence in, particularly because we are getting a lot of requests for that same thing. So I think Megan and CCHA and myself can really make some positive groundwork with that. One thing to note that is we did get word from the Boulder County Recovery Center and saying that they're completely up and running and they are able to transport patients via bus. At the time that I got the update that they were able to transport one person at a time, and in between each ride, they were cleaning down the buses to make sure that there was no cross-contamination with folks. They are also able to dispatch people to different shelters and primary care providers to then transport them back to the shelter where they might need to be quarantined or sequestered away from other folks. And this is mainly dedicated for the homeless population. Outside of that, I don't really have a lot of updates. We have also identified two other agencies. Let me get my notes together and I can tell you exactly who those are. Sorry about this. But one more thing to mention while I find this is we are also kind of in very, very early talks with kind of the rideshare providers as well to begin to see if we can even partner with doing kind of a non-emergency medical ride idea. to kind of take care of some of that burden, as well as looking at our already in place non-emergency medical transportations to figure out if like things like Accessoride and Telluride might be an option for this particular region. So again, not a whole lot of movement has been made, but I'm pretty confident that after talking to Z-Trip, we might be able to make some moves there. And that's all I have.
Great, thank you. And I do know that on this call, I mean, we have VIA Mobility Services and then also Accessoride, and I know that they have capacity. I don't know if they have capacity to transport people or the procedures in place to transport people who are potentially positive, but those other non-emergent medical transportation trips, if you're still looking for providers, they might be good organizations to reach out to.
Definitely, thank you. Yeah, we're still able to do the non-emergency one. It's just the COVID specific people who might be positive. That's kind of what we're looking for. But understandably, it's just been a barrier. But it also makes sense why it is. So.
Yeah. Okay. Does anybody have any questions for Brandon before we move on to VIA? Okay, well, thank you, Brandon. I really appreciate it. And if you have questions for Brandon, go ahead and put them in the chat function and we'll try to get those answered on this call. So next we have VIA. Lisa Bitzer, I know you're on a cell phone. Would you like to unmute yourself and give the VIA update?
Yep, things are keeping on at VIA. We are doing grocery delivery, prescription pickups. We can get groceries from Walmart, King Soopers, Safeway. All the people have to do is go ahead and call it in, pay for it, then give us a call and we'll go pick it up. 24 hours notice is helpful, but we can do same day. And we're also doing food pickup from Community Food Share, from EPA, and from other agencies like that have some free food for people. And we can deliver that as well. And then on Saturdays, we're working with the Boulder County Farmers Market, delivering food, produce, meat, eggs, milk, things like that for WIC families, families that are on WIC. And that is all of Boulder County, Broomfield, Brighton, and basically wherever they need us to go. So we're averaging about 115 trips on Saturday doing that. We've seen a little increase in our ridership, mostly medical appointments since that sort of opened up, but I wouldn't say it's big by any means. We're still way below our normal rides that we would do. We've still got a lot of our drivers furloughed, office staff, some of us working from home and going into the office here and there, some of us working from home all the time, and then a few of them in the office. So we're trying to keep that at a minimum. And if someone needs us for something, and they need to go somewhere, and we've taken one lady up to Fort Collins for a medical appointment. So we're doing things outside the norm and trying to help the community. Unfortunately, the one thing that we are not set up to do is that if someone thinks they're positive for COVID, we cannot provide transportation.
Yeah, and that's really a safety concern for your drivers.
Absolutely, we're just not set up for that.
Mm-hmm. So does anybody have any questions for Lisa or any potential overlap where you could reach out or use somebody to deliver transport, like food? I know we have a couple of the basic needs on the call.
This is Dinah from Lafayette. Lisa, is the prescription pickup service, is that free like the groceries, or is there a fee for that?
No, everything that we're doing is free. We've waived all of our fees.
Great.
And Lisa, I know on the mountain transportation listening session that we did earlier this month, that we had a discussion about transporting narcotics. Has that been an issue for you all? You said you don't know necessarily what people are transporting.
Yeah, so far, I guess it hasn't been a problem for us. I mean, we don't ask what the prescription is and they don't tell us. We just go pick it up and bring it to them. So far, no problem whatsoever.
Okay, great. So do we have any other questions for Via before we move on? Okay, thank you, Lisa, for giving the update. So let's see here. My mouse is not working. Okay, there we go. So as I had just mentioned, we held a mountain transportation listening session. And as Tammy had mentioned, we're still working on that volunteer driver plan. We probably won't be able to launch the volunteer driver program in the mountains until probably next year, we're looking at now. But we did want to check in with all of our mountain stakeholders and the Peak Ride Mountain Transportation Planning Group that we met with all last year, just to see what transportation changes have happened since COVID. And just to let you all know, basically we ended it that Lisa Bitzer, Jeanette Taylor, and I will meet probably next week to talk about Friends and Family, which is the mileage reimbursement program that VIA has, to make sure that people in the mountains are aware of what that process looks like to get reimbursed for mileage. Some of the gaps that the mountain area has identified right now are the ability to deliver narcotics. Like, so if somebody has some sort of narcotic grade prescription, currently some of the volunteers that they're using through the church aren't able to pick those up on their behalf. So we had a couple people follow up to see if we could see if we could fix that issue. But they have a wonderful volunteer network that has sprung into action in the Peak to Peak region through the church. And they've really been trying to do grocery delivery and basically meet people where they're at. So we do have a couple things to follow up with that meeting, but we do think that longer term, there's going to be more transportation barriers in the mountains. Tammy, I don't know if you have any other updates to add, because I know you attended that meeting. Anything that I forgot to include?
Nope, not that I can think of.
Okay. Well, thank you. So I just have a few before we get into some of the presentations. I have just a couple updates. So right now, Mobility for All, we're conducting a program evaluation. So there is going to be there's going to be a survey that I'm going to send out to you all just to see like how we can do better moving forward, and then also how what the needs are that you see in the community. It's going to be a short survey, but we are interviewing some of the stakeholders that we wanted to like dig down to see how we can partner a little bit closer and a little bit better. So we are doing some interviews, and I want to thank the people who are on this call that have done interviews to date, but this will all feed into our strategic planning process. And for our strategic planning process, we're going to be doing an RFP for that, and we'll hire a consultant to basically lay the groundwork for the LCC and Mobility for All, like basically what we want to focus on over the next 3 years. And we have talked to VIA, and we've talked to our like leads internally. And I do think that we're going to be calling it a coordinated human services transportation plan. I know that we have an upcoming regional coordinated human services transportation plan presentation here soon that Dr. Cog's doing. But I do think that we're going to flesh that out a little bit more at the local level to prioritize projects that we would like to see to meet the mobility needs of limited mobility individuals moving forward for the next 3 to 5 years. So just keeping that on the horizon. I'm hoping that we can dedicate the next session to that strategic planning process, but we still haven't hired a consultant yet or released the RFP. So it might actually be June or July that we focus on that as an LCC. Additionally, the technology workshops, we've postponed them, but in June, I do think that we're going to roll them out virtually We just are trying to do a refresher session for a lot of the people who have attended the workshops to date, so that we can work out the glitches on our end. So this month we're focusing on just working out the glitches and doing refreshers with people who have attended those before, and then we'll probably provide virtual sessions with the Eventbrite registration to help people access transportation through technology. So I don't know if you have any other questions or any questions for Mobility for All before we move on. Okay. So anybody else?
I have
Oh,
a
go ahead.
question. Sorry, Angel, this is Whitney from City of Boulder.
Hi, Whitney.
I know you and I have spoken about holding these workshops, and just will you reach out, or will I need to, about rescheduling in the future when we're even ready to do that, or virtually?
So as far as the senior centers, so we did have them scheduled with all of the senior centers. And as far as in-person classes, it doesn't seem like any of the senior centers are going to be in a position to do in-person classes.
Right.
So at this point, I think that the ones that we had scheduled for the spring and summer for the senior centers, we're going to tentatively reschedule them for the fall. Assuming that the senior centers will all have their own policies on when they can hold in-person classes. If you all are talking about moving some of your curriculum to online, we can definitely talk about what that looks like.
Okay.
And I do think that there are plenty of people that the online format might work for, but there's still also a lot of direct one-on-one assistance that's not going to be as helpful for. So I think as the longer this lasts, the more we're going to really need to address those technology barriers. But yeah, I'll reach out to you and let you know just fall time period. We can put a placeholder in place.
Absolutely. Thank you for the answer there.
Thank you, Amy. Any other questions for Mobility for All before we move on, or any other updates that people have? Any transportation barriers that you all are experiencing with your clients? Okay. Okay. Is anybody experiencing any barriers to accessing the food banks, or any barriers that we can help address as a local coordinating council? Okay. So we'll go ahead and move on. If you have any barriers that you can think of as they come up, just put them in the chat and we'll read them out and make sure we can brainstorm and kind of collectively address some of those barriers. I love seeing all these organizations really changing their format of their service delivery model and really being adaptable to the new COVID crisis. So I think that we've heard some really wonderful examples of innovation and just adaptability. So I just want to thank all of you for the updates that you provided. So we do have 3 presentations that we're gonna have today, and one of them, the second one with Dr. Cog, is actually going to require that you all have your cell phones if you can. If not, they're doing a real-time polling for their coordinated human services plan. So just, I know sometimes it takes a little bit for us to get all set up. So just keep in mind that if you want to participate in that real-time polling, that they'll be doing that probably in about 20 minutes now. So you'll be able to have your phone. So next we will have Jocelyn, if you want to go ahead and jump on.
All right.
I'm gonna open up the presentation that you sent me prior.
Great, thank you. And thanks for having me, Angel.
Yeah, thanks for joining us. I really appreciate it. Okay.
I'm Jocelyn Fankhauser, and I am the Emergency Coordinator for Housing and Human Services and Community Services. And generally, I help to facilitate mass care and volunteer donations. But our response to COVID has been very different here in emergency management. So I have been facilitating with vulnerable populations as an entire branch, with homeless sheltering being under that as well. So Angel, if you go to the next one, Thank you. So the Emergency Operations Center, if you don't know, the Emergency Management Office is a Boulder County, City of Boulder office. It's funded by both. And I work for Housing and Human Services, so I'm kind of an offshoot of the Office of Emergency Management, but work very closely with them. So during this COVID operation, we had what was called the BACMAC, which was an area coordination organization here at the EOC. Instead of supporting, say, our firefighters that are out in the field and doing operations that support them, we actually did area coordination across the entire county. We had a county agency administrators team, which was made up of school officials and county commissioners and city managers and city commissioners. Public health, of course, was a big part of that. And we had a staff activation since the very beginning of March. So all of us here at the Emergency Operations Center have been coming into the office and facilitating a lot of work that has been going on in the community behind the scenes. And a lot of it you might not know about. One of the branches of the Emergency Operations Center is our resource management and resource ordering section. Generally, what the resource ordering section would be doing is maybe in a wildfire, they're calling other counties or other agencies and getting fire trucks or personnel that would come and put out the fire, or they're organizing the food for the firefighters or organizing food for us or supplies, things like that. In the flood, for instance, they did 435 orders during the 2 weeks that they were activated here at the EOC. And we are still activated. I think we're on our 9th week of activation. And our resource ordering section has filled over 1,100 orders. So that's a lot of ordering that's happening. But it's also why Boulder County, in my opinion, is doing so well. So we have been supplying all of the PPE for our hospitals, all of our hospitals. That means all of the masks, all of the gloves, all of the face guards that they get. We've been facilitating all of those orders out of China. All the nonprofits, the food banks, they're getting all of their PPE from us, the shelters and the long-term care facilities, particularly paying attention to shelters and long-term care facilities and making sure that they've had the supplies that they needed. Early on, we were even trying to find toilet paper, say, for some of our local shelters. So we've really been busy here doing that. Helped facilitate setting up the COVID Recovery Center here in Boulder, which is a pretty unique center. We were the first one to open up. Huge lead by the City of Boulder staff that really understand and know way more about homelessness than I do. I just helped do a lot of the facilitating of what needed to happen here, funding, taking things to the agency administrators, etc. And that COVID Recovery Center for the Homeless is still operating. And to date, we have had 6 people who have tested positive out of the 55 people that were screened at all 3 shelters between Longmont and Boulder. And then we had a couple of referrals that came straight from the hospital where an individual may have been admitted to the hospital and then they were being released and they needed a safe place and a comfortable place to recover. So our recovery center was at the East Boulder Community Center here in Boulder, and it provided very robust supports for them to make them comfortable. Also did a lot of work monitoring childcare, pushing out a lot of information through our information centers regarding childcare, regarding resources for seniors and resources for our food banks. But a lot of those key areas are indicators in our community where you might see that people are suffering or they need more help or we need to get something different in place. I had heard that VIA was doing prescription delivery and grocery delivery. That was a big worry when this first started happening, is how are our vulnerable seniors or vulnerable people going to get the things that they need if they can't leave their home? So making sure that they have the appropriate PPE. We still can help facilitate that. So if any organization that is serving vulnerable populations needs or can't get a hold of the cleaning supplies or the masks that they need, please get a hold of me here at the EOC and we can help get you set up with the Amazon account, which is a special Amazon account for those that are serving vulnerable populations. That's something that I can help that we can still offer. Move on to the next one. see the whole, oh, okay, here we go. So in Housing and Human Services, of course, I've been really involved in paying attention to what everything that Housing and Human Services has been doing, which has been amazing work. And I could probably talk for an hour about all the different things that they're doing. But here is just a very quick list. You know, Boulder County has a funders collaborative. We have an investment group that looks with our partners. We have a senior leadership team plus that met on 3 times a week, actually early on, and now it's down to twice a week. We have regional partner call, community partner calls, the Human Services Peak to Peak Task Force calls. We have maternal child coordinated services systems, executive steering committee that meets, and our homeless solutions executive board meetings. And that homeless solutions executive board is what's looking at, you know, next steps for our COVID recovery center for the homeless. We work really closely with public health. Public health has their own incident management coordination group. They have their own incident commander, and we work really closely with them. One of the big things that they have been doing is, of course, looking at the testing and the numbers. And you've probably seen a lot of that if you go to the Boulder County Public Health website. You'll see the breakdown of numbers in Boulder County by age, by race, by location, etc. Behind the scenes, what was happening even more is we were monitoring hospitals. And so we put a lot of things in place so that we knew exactly the number of ICU beds were available on any given day, the number of ventilators that were available every single day. And so we could see and monitor those trends that were happening across Boulder County. So now, as we're transitioning more into this stay-at-home phase, or safer at home phase, I should say, oh, excuse me. We've instituted some additional community monitoring system. So you've probably heard a lot of people talking about that testing just isn't as widely available as we would like to see it. Everyone just can't get a test very easily. So what are the other ways that now that we're moving to spreading out and having more movement in our community, how are we looking at ways that we can see, is the virus starting to spread again? And what we've put in place is some really great indicators. So they're actually pulling out 911 calls and they're aggregating data based on what those calls say with key points. So they're using, you know, keywords that get pulled out and put into a spreadsheet so that they can monitor that. They're still monitoring the hospitals really closely. They're looking at the number of ventilators that are in service, the number of people, the number of med-surg beds, etc. We're also very closely monitoring our homeless population still. So we're still screening at all 3 of the shelter locations. Anyone that has primary symptoms of COVID is taken to the COVID Recovery Center. And probably to answer a question about transportation, we've got a donation of some vans, and we have volunteers that pick up all of those folks and bring them to the COVID Recovery Center. And then they also use those same vans to transport them to Clinica for testing or for other needs. And they have, you know, been doing cleaning in between. Now they weren't doing the misting, but just wiping down all the surfaces. Everyone is wearing a mask. Everyone is wearing gloves. And that process has been working really well for us. Additionally, the other indicators that they're looking at, they're also picked out some key physician offices that they will be getting surveys from every day. People that they are referring maybe back to home or to testing, so that we're monitoring a little bit more. Those aren't confirmed tests, but those would be people that are indicators of tests. Also looking at, like I said, the hospitals, and then that 911 data, and then the shelter data. We're also monitoring shelter workers and shelter volunteers. So, you know, we had monitoring, say, Boulder Shelter for the Homeless has 1 employee out of 12 that is out with positive COVID, something like that. So we're looking at those key indicators and then giving that information to public health so that they can make informed decisions about what's happening in the community. So that's one of the other areas that we've been working on here at the EOC. I'm sure most of you know, but I really wanted to put it up here. Boulder County has a resource page, and we have incredibly robust resources for our through Human Services. Each of these, this is just a snapshot of the page. Each of those, so if you want information on unemployment, you go to that drop down and it gives you very specific information about where to go and what kind of information you can expect to get from those drop downs. I put the link to the site on the very top. It's Boulder County COVID resources. If you just Google it that way, instead of trying to dig through the pages to get to it, it takes you right to that very quickly. We're working really closely with our family resource centers to get services and money to them so that they can provide the services in the community as best that they can. We're really helping people who are coming into HHS to sort of triage. Have you applied for the most federal dollars like unemployment, SNAP benefits, TANF benefits? So many of those benefits have been expanded. Like everyone right now is receiving max TANF benefits, or max SNAP benefits, regardless of what they were getting before. So kind of helping people walk through that process. You can also text. You can text our number, our 441-1000. There's a different number it'll tell you, and I can't think of it off the top of my head. And it triages you through that system, and then you can also text someone, so you don't have to sit on hold. You don't have to leave a message. So I'm really, really proud of the work that HHS has done and getting services out to our community. So like I said earlier, our strategy has been to support our partners and let them do what they do best. We're not trying to recreate the wheel like some counties have done. We have really robust programs here in Boulder County, and we have great, great partnerships with all of our nonprofits. So the Community Foundation, for instance, has raised a lot of money here in Boulder, and then they're funding out those dollars to the local nonprofits to provide services right directly to clients and residents. Federal dollars, HHS is looking at all of the different federal dollars that we can draw down that are being made available, and then helping every person look at duplication. So if someone comes to us and they got an extra amount of unemployment, for instance, they might actually be making more money than they were making before. So they technically should still be able to pay their rent. And then if they go to a family resource center and they say, oh, I can't pay my rent, it's probably an indication that maybe they spent that money on something else, but maybe there wasn't something else that they needed to spend it on. So we're working with each individual client to determine what their needs are and to find the help that they need in the community. And here's my information. Feel free to call, text me, shoot me an email if you have any questions about anything that's going on here at the EOC. If you hear of anyone who's having any trouble getting the personal protective equipment that they need in order to serve our vulnerable population, I really want to know that information. And I really thank Angel for having me on today, and I'm happy to answer any questions.
Great. Thank you so much, Jocelyn. I'm not sure if you guys have questions or not. I do have one question that came to mind about testing. And at the point where we really are able to ramp up testing in the community, are we considering bringing the tests to people to test them where they're at versus having people come to Clinica or Salud to go through the test procedures?
You know, I'm not a public health expert, but based on everything I'm hearing here, I could probably say with pretty good certainty the answer would be no. So public health actually is not doing any of the testing in our community. All of the testing that is happening is through individual private entities like Clinica or King Soopers. You've seen some drive-through places. Those are not organized and driven by public health. Now that's not the same in every county. As you saw in Denver, Denver did a drive-through facility, and that was facilitated out of the governor's office, but that was only open for 3 days. So a lot of these are popping up, and I know that it's a big question around getting the testing and getting them to the right people, but at this time, no.
So that sounds like there's not like a coordinated effort to look to see how people who don't have cars can get to those testing sites?
I don't think so. I don't think so. Now, I do know that anyone who has contacted their local area agency on aging or, you know, got that information, they've tried to, most of the resource centers have found ways to help people pay for it so they could use more private facilities.
Okay. So do we have any other questions for Jocelyn?
Thank you, Whitney, for driving at the CRC.
Yeah, I just wanted to say that. So Whitney Garcia is driving for the COVID Resource Center, the Community Resource Center. That's great.
You're so welcome. It's been a pleasure. I'm happy to help in that way.
Thank you.
Yeah, thanks for the organization, all the organization behind it.
So if anybody has any questions for Jocelyn, you can either email her, call her, or put it in the chat, and then we'll follow up with her afterwards. I just want to thank you very much, Jocelyn, for taking the time. I know that you all are really busy, and I really appreciate it. Okay. So next, we actually have a presentation by Dr. Cog. So this is the one that's going to have that interactive component that I talked about with your cell phone. I don't know, Matt, if you're going to start us off or not.
I am.
Okay.
Hi.
Wonderful.
Good afternoon, Matthew Helfand, Senior Transportation Planner at Dr. Cog, and I'm going to be talking about our Coordinated Transit Plan. So next slide. So here's a little bit of background. Many of you know, but Dr. Cog has several functions. We're a regional planning commission, an area agency on aging, and a metropolitan planning organization. Next slide. So here's some information about our area agency on aging. When it comes to transportation, they do fund quite a bit of transportation with Older Americans Act dollars in the community. Next slide. And so here are the Dr. Cog planning boundaries. For the purposes of the Coordinated Transit Plan, the entire map, no matter which color, is within the boundaries of the planning area for this particular plan. So next slide. So just a little bit of background on regional transportation planning. So we have the umbrella plan, the Dr. Cog MetroVision plan, which includes land use and transportation. But then if you go in a little bit deeper, we have our MetroVision Regional Transportation Plan, which is a vision plan for our transportation system, long range. Then we have our fiscally constrained plan, which takes into account reasonably expected revenues, and then puts that together with projects and project types. Basically spends the reasonably expected revenues over the planning horizon. And then there's the TIP, or the Transportation Improvement Program, which is a 4-year program of funded projects that are either regionally significant and or federally funded. And so then at the project level, then there's additional work for project sponsors to do. And air quality conformity comes into play for the fiscally constrained plan and the TIP. Next slide. And so just an overview of the MetroVision Regional Transportation Plan. It's our multimodal plan. It helps implement MetroVision, and it addresses federal requirements. Next slide. And this is our timeline. We are in, obviously, spring of 2020. So we already started our engagement and education, but this component, the Coordinated Transit Plan, is a component of the MVRTP, and we're conducting engagement with the community, including today, within that second period there, the winter, spring. And as you can see, we anticipate adoption of the plan in spring of next year. Next slide. And so these are just a list of some of the strategic issues that we're going to look into as we develop this plan and as we continue to meet with the community. Next slide. And so this is just a long list of our planning participants that we work with in the community. We work with many, including local governments, and of course that includes local coordinating councils. Next slide. And so I mentioned the fiscally constrained plan before. These are the primary sources of funding that go into our formulations for the plan. So, you know, as many of you know, the federal fuel tax and the state fuel tax haven't been increased in a long time. You partner that with better gas mileage for vehicles, and it's not providing nearly enough revenue for transportation. So the federal general fund, other state funds certainly have to pick up a lot of that slack. Then, of course, RTD also gets sales and use taxes from the community, as well as fare box revenues. And then, of course, local governments certainly come into play. There's usually local shares involved with grants, but then local governments also fund their own programs. And then tolling and public-private partnerships are becoming a larger portion. Next slide. So as many of you may know, the DRCOG board set aside $4 million over 4 years through our transportation improvement program to improve mobility for vulnerable populations, including older adults, individuals with disabilities, low income, veterans, and many others. And we are trying to have maximum flexibility. And in that vein, we've swapped the federal dollars for state FASTER dollars, which allow even greater flexibility with not only project type, but they can count toward the federal local match for other types of grants like 5310 and Older Americans Act. And so it reduces the match requirement for the project sponsors, which means that they can afford to apply for more funding and grants, and ultimately it means more services for the community. Next slide. And so I'll go into a little bit more detail on the coordinated public transportation, human service transportation plan, and that's the last time I'm going to refer to it as that, or the CPTHSTP, which is one of the worst acronyms I've ever seen in my life, but we're just going to call it the Coordinated Transit Plan. So it's required by the FAST Act, which is the current surface transportation legislation at the federal level. It's incorporated into the 2050 RTP. It describes existing coordinated transportation activities. It analyzes available data and recent surveys. Of course, it takes into account all the input that we're receiving from the community, and including what we will get from you today. And some of that information that we want to get from you are gaps, needs, strategies, and future coordinated transportation activities. And it also helps define what's eligible for the FTA 5310 program, which DRCOG is a new administrator for. Next slide. What the coordinated transit plan does not, it does not fund specific projects. And the second one's important, given what Angel said earlier. It does not preclude local coordination plans. So thrilled to see that you guys are embarking on your own local coordination plan in your community. So next slide. This is just a little bit of information about DRCOG being the designated recipient for 5310. We have a call for projects out right now, and we anticipate contracting in the fall of 2020 and starting those projects in January of 2021. Next slide. And coordinated transportation activities. So DRCOG now administers 3 funding sources, and this gives us a great opportunity to have one call for projects, invoicing and reimbursement that's simultaneously in concurrent auditing and oversight, ultimately looking to streamline the process and make it easier for everyone involved. So with that, colleague Lisa.
Hood, and I am a public engagement specialist for DRCOG. So really my job is to make sure that we hear from as many people as possible on all of the projects that we're working on. So I am really grateful that you all, it's such a great turnout to this meeting today and that we have the opportunity to chat with you today. So I just want to give you a little background about what we are hoping for today. So your input is really a huge part of this plan, and we really need to hear from the local coordinating councils in our region. Your voice is just absolutely critical to making this plan as good as it can be. So we really appreciate Angel giving us the time on the agenda and you all just spending some virtual time with us today. So what we're going to ask, or what we're asking from you, is some help identifying some of the main needs and gaps, developing and prioritizing some of the strategies to address those gaps. And as Matt plan is updated every 4 years. The last plan was completed in 2016. And so kind of what we're thinking about today is focusing on what has changed in this realm in the last 4 years. And I know it's a really odd time right now to be asking with the COVID situation. That's obviously very unique, but kind of just thinking of this as a long range plan and trying to identify the needs and strategies, just generally not specific to what's been happening these last couple months, but it'd be really helpful to think of it kind of in a more general level. So today we have a brief exercise and discussion that we can have today. We're going to use this interactive web polling feature that we have. Obviously, we wish that we could just be there in person with you in your meeting and be able to talk to you in face-to-face and really facilitate a good discussion, but we tried to think how we could best adapt this to kind of the virtual environment. And so we had to make some adaptations to what we would typically be doing for engagement. So we are focusing on that interactive web polling, and what we're going to do is about a dozen multiple choice questions. And as Angel mentioned, it might be most helpful if you can use a smartphone for this, but we'll also have an opportunity for 2 kind of more open-ended discussion questions if you want to speak up, and we can kind of discuss that way. If you're not able to participate today, I know there's a few people that are on the phone, there will be a follow-up questionnaire. We actually sent it out to a couple hundred people last week, so you might have been on one of our mailing lists and have already received this questionnaire, but the questionnaire has really similar questions to what we'll be doing in the exercise today, and there's a couple opportunities within the questionnaire to provide some more detail. The questionnaire is screen reader friendly. It's just a SurveyMonkey questionnaire. So the link is here. I can also put that in the chat box if anyone wants to do that as well, or we can mail a hard copy if that works as well. But for those of you who can participate today, we'll go into that activity. Oh, I wanted to let you know kind of the ongoing plan for engagement before we start the activity is that questionnaire has been sent out to many different local governments, the TMAs, the different local coordinating councils, our county councils on aging, and then our accountable health communities, advisory board, and provider groups. We're also going to be going to our DRCOG Advisory Committee on Aging meeting later this week. We have a couple of advisory groups for the MVRTP, the MetroVision Regional Transportation Plan, which are also providing input. We're hopefully going to be attending Colorado Access meetings if those are made available virtually. And then we're going to be attending a bunch of different local coordinating council meetings over the next few weeks. And as Matthew mentioned, this plan is really part of the 2050 MetroVision Regional Transportation Plan, which is scheduled for adoption in early 2021. So there'll be another opportunity to review the draft kind of end of this year, early next year. So with that, we can give you a break from all the slides and we'll jump into the activity. So if you guys can go to, can you guys see this other screen now?
Yes, we can see it.
Okay, so if you go to www.menti.com, and you can either do that on your phone or if you can open another window on your computer. It's a little bit easier if you use your phone just because you can see the results at the same, you don't have to move the windows around a lot, but either way. And then so go to menti.com, MENTI.com, and then you input the code 401205. And those instructions will stay at the top of the screen if you need them. We have just a few little fun test questions just to get you used to how the interactive polling works. I'm going to hide with this image. It's good timing because it's a dreary day. All right, let's see what people said. Oh, everyone always knows the answer. It is June 12th was the last time that we had a trace of snow in the Denver area. So don't get too ready for summer yet. All right, so that's kind of what a multiple choice question will look like. And then we'll do another one just to test. This one is just to show you how to type in what state or country did you grow up? And you can type it in and it'll pop up on the screen for you. And the more votes or the more answers that we get of the same state, the bigger it'll be. So you can see, got a few Californias. We don't have very many Colorado natives. All right, so that gives you an idea just of how this tool kind of works. So we have just a few multiple choice questions and then a couple open discussion questions like that. So we'll start with the real questions per se. So in which county do you reside? I'm gonna guess that you guys are gonna be a lot of Boulder. All right, so as anticipated, definitely a majority Boulder, but we've got a few people from Denver, Broomfield, Adams, Arapahoe, and somebody from another Boulder. Okay, which option best describes you? Are you a transportation provider, user, advocate, local government, or other? All right, looks like we've got majority local government or transportation advocate, but a few of each of the other options as well.
And I just want to hop on and remind people that the menti.com and the code is at the top of the slide in case you didn't get a chance to log in.
Perfect, thank you, Angel. All right, which description best describes either you or your clients? Older adult, low income, individuals with disabilities, 2 of those, all 3 of those, or other? All right, looks like the majority are all 3 of those options and then a few others. Go to the next question. So these are some questions that we asked for the previous plan, so we'll be able to compare also, which will be helpful. So what is your perception of the effectiveness of coordinated transportation at the local or county level? All right, pretty good. 18 for good, 2 for excellent, 9 fair, 1 poor. And then similar question, but different level. What is your perception of the effectiveness of coordinated transportation at the multi-county or regional scale? All right, looking pretty different than the local version of that. Mostly fair, a few good, a few poor, a few not sure. All right. So the next question, when I was thinking about how to frame these questions, I really wanted to go back. As I mentioned, there is an existing plan that we update the plan every 4 years. So what I wanted to do was kind of go back to where we were in the last plan and really focus on that. So you don't have to look at each one of these items because we're going to go through them in kind of sections. But I really wanted to focus on what did we say in the last plan as a region were our main transportation needs, and kind of where are we at in 2020 with those needs. So I've grouped them into kind of categories. And this question will be a little bit different because you'll be rating. So you're going to rate from low significance to high significance, each one of these needs that were identified in the previous plan. So the question asks, how significant is this need in 2020? And then you choose the rating, I think it's 1 to 5, based on what the significance of the need still is in 2020. And this one is a little more reading, so it'll be a little bit slower. And if you have any questions or need clarification on anything, feel free to speak up. So it looks like affordable fares is still a really important, really highly significant need, as well as increasing the service areas, frequency, and service hours. A little bit lower for the removing barriers to ride fixed route and access. All right, we'll move to the next set. So these are focused on coordination. How significant are these needs in 2020? More cross-jurisdictional trips, better trip coordination, and more accessibility. And then the other one is better regional coordination to build on improving local coordination. All right, so these coordination ones are still ranked very high. Both of them, almost, well, now tied at 4.3. Oh, top one's popping to 4.4. All right, so still seeing those as really, really highly significant coordination-related needs. Jump to the next one. So these are related to kind of general service expansion. How significant are these in 2020? And the different options are meet increasing demand for transportation as the population increases and ages, expand volunteer driver programs, increase transportation options for quality of life trips such as hair appointments and social visits, improve access to healthcare for non-emergent visits. All right, still mostly above 4. Looks like the expand volunteer driver programs is rating a little bit lower significance than others, which is interesting because in the questionnaire results that we've gotten so far and we presented at Dr. Mack last week, this is similar results to what we saw there as well. But 4.5 for the top and bottom ones, and then 4.2 for increasing transportation options for quality of life trips. All right. One more and then we'll have a kind of more general or discussion question. How significant are these needs in 2020? These are kind of outside of those other categories. First one is making sure that veterans have access to transportation. And then the other one is accessible and understandable transportation information and referral services. Something not working with the voting? Oh, there we go. Oh, I got all 22 at once. All right. Also still very highly significant. So yeah, I mean, we expect some changes over 4 years, but we weren't anticipating that any of these were going to be definitely not a significant need 4 years later. So this is really helpful information. All right, so kind of the just general open for discussion question is that was a lot of different needs that were in that last plan. What other needs are there that you thought of that haven't been mentioned? And what you can either do is you can type in, same as you did when you typed in the state you were born in, your ideas. You can see that's how that pops up, or feel free to unmute yourself and say anything that way if you'd rather do that. Looks like somebody put in technology barriers. Good one. First and last mile, continued delivery options past COVID, definitely. The use of new transportation technology, electric bicycles, first and last mile again, that's a popular one. And electric bikes. On-demand services, first and last mile. Great minds think alike. Self-driving cars due to driver shortages, using apps and Google Maps. Free e-bike through city bike share program. Continued revision of services for disabled. Technology training for vulnerable populations. RTD acting on the needs of our communities. Apps and technology training, lots of technology. Better, safer access for pedestrians. E-bike storage, secure storage. Seconding the technology training. Bus stop improvements, these are all great. Bike safety for people with disabilities, rideshare program coordination and technology. Walking districts. More. Helping people see that they can use other options besides driving themselves. Solar-powered bike share stations, so there's no need for expensive electric power construction. Yeah, one of the things that Matthew had on one of his slides but didn't hit on was just what lessons can be learned from this pandemic. So just kind of to the point of helping people see that they can use other options besides driving themselves. Kind of we're learning how things can be delivered and kind of developing all these new systems for new ways to get places. So there hopefully will be some lessons that we learn through this whole situation. Training for transportation providers to work with folks living with disabilities. That's one that came up at Dr. Mack too. All right, well, we'll go on to the next kind of round of multiple choice questions. I have just a couple more, but again, we do have that questionnaire. I'll put that in the chat once my presentation's over, and you can feel free to add more detail there if you come up with any other ideas. All right, we'll move on to the next one. So the next big thing, the next big part of the plan is the strategies and activities to address those identified needs and service gaps. So these are the ones that were highlighted in the previous plan. And what we're going to do is just kind of go through each one of those and decide, decide what level of priority do you think should be given to each of those strategies to address the current needs and gaps. So similar rating system, but this one is from low priority to high priority. And Matthew, do you want to speak up and explain the transit supportive land use and the travel training ones?
Sure. Transit supportive land use is basically supporting land use policies that are more density, more walkable, so that it makes transit more efficient to provide. And then travel training is providing training for either persons with disabilities or just people who are not comfortable riding public transportation to help them feel more comfortable and be able to use it.
Thanks, Matthew. All right, looks like affordable fares program, still a very high priority. Then the first and last mile connections, which makes sense because you guys brought that up in the last one as well. Then we've got the transit supportive land use, the piloting new technology and practices to improve mobility, travel training, and then those infrastructure improvements. I'll give a little more time for people to get their votes in. All right, move on to the next one. Just kind of the next group of these, same question. What level of priority should be given to each of these strategies to improve coordination? There's spend funds more efficiently, increase human service transportation coordination efforts, address cross-jurisdictional, cross-service boundary, interregional trips, and improving access to key services such as healthcare and employment through coordination. All right, looks like most of these are still very high priority, all above 4. So all pretty similar results for each one of those, maybe a little bit lower for that increased human service transportation coordination efforts. All right, and just one more opportunity for kind of general discussion or typing in your answers. Are there any other strategies that you think could address the current needs and gaps? Anything that wasn't covered in those kind of 10 that we just went over, or anything that sticks out to you that might be missing kind of in the context of 2020? Internet access. Yeah, that's important to all of the technology ideas for the last one. AV tech. Another internet access. Single payment option for all providers. That came up in our Dr. Mack meeting as well. Outreach to rural communities. That came up in Dr. Mack as well. Higher gas taxes. Yep, Matthew pointed on that. Community mobility centers located in workplaces and neighborhoods. Free transit passes, free Wi-Fi. Road design that fully accommodated bikes, pedaling, and transit. Rethink urban design in terms of cars. Flexibility and funding, that's a big one we've heard. Wi-Fi on transit. More funding for vulnerable populations. Regional bikeways. Eliminate free parking region-wide. Low-stress bike networks. Any other ideas? Anything else that stands out? Something that could address some of those needs and gaps that we talked about? some of the ones that you come across most often. Transit-friendly urban design, incentives to get drivers out of their cars, mileage-based motor vehicle insurance, cross-sector projects, public, nonprofit, for-profit. They're all really great ideas. All right, well, in the interest of time, I know you have another item on your agenda. We'll stop there, but I will put in the link to the questionnaire in the chat. And again, we really appreciate you taking the time to kind of play this interactive polling game with us, provide your input. It really is just absolutely vital to creating the plan and really setting up a transportation system for our region that can address these needs and gaps and really set the priorities for strategizing how to address those. So thanks again for the time, and you'll get that link here shortly. And thank you.
Great, thank you, Lisa and Matt. I really appreciate it. So thank you all for participating in that fun exercise. So next we are going to look at, we went from regional, now we're going to go to local. So Megan, if you could pop in, and I know you have a PowerPoint to share.
I do. Let me pull it up and. Okay, are people able to see the slideshow? Angel, can you see that?
Yeah, we're good. Thank you.
Great. Okay, wonderful. All right, well, this is Megan Davis. I'm with the City of Louisville, and I really appreciate everyone being here today and giving us the chance to talk a little bit about our transportation master plan. I have quite a few slides here, but I'm going to zip through some of them a little more quickly and just try to focus on what may be most relevant to the conversation today. And then Angel has a copy of my slides, and so she can distribute them to the group. And then I've also shared with her a link to our transportation master plan. So you can take a look at the master plan if you have specific questions or if you need kind of additional information about what's included in the plan. And then in the slide deck, I've got my contact information, so people can feel free to contact me if you have follow-up questions as well. So just a little history. The City of Louisville began our first transportation master planning process in early 2018. We did not have kind of an overarching guiding transportation document. Our comprehensive plan had transportation components, but this was really an opportunity for us to look at all the transportation conditions across the city and look at all modes of transportation here in the city and come up with a comprehensive plan for our transportation system for infrastructure and investments. So our plan was adopted in October 2019. And since that time, the city has begun the implementation of the TMP projects. So I'm going to tell you a little bit about kind of what we're working on right now and just give you an overview of what's in the plan. So the purpose of our plan was is to discuss the key transportation trends in the city's existing transportation system and then provide recommendations to improve our system to meet future needs. So a lot of what we did initially is really do some extensive data collection and analysis and look at the current conditions within the city and also look at trends, regional trends and local trends here in the City of Louisville. And most of you, I think, are probably familiar with the City of Louisville. And I think like many other locations in Boulder County, we have the majority of our travel that comes in and out of the City of Louisville. So, and a smaller percentage that is internal within Louisville, where the trips originate in Louisville, going to places within Louisville. Our population is, we have a little bit of growth happening, but pretty much built out. So there's a little bit of information about our population. And as with many other communities, most of the Louisville residents do not work and live in Louisville, they work outside of the community. And likewise, most of the people who work here in Louisville are coming in from other communities. So this, reinforces the commuter issues that many of us have in our region and the importance of our regional efforts around transportation and working collaboratively with our neighboring jurisdictions and our regional partners around transportation issues. The demographic trends are similar to what we see throughout the rest of Boulder County. I think one thing that is the same is that our population that doesn't drive or is driving less is increasing. And so our transit and multimodal needs will continue to grow. The city of Louisville does have a slightly higher percentage of seniors over the age of 65 than Boulder County, which is of course higher than the rest of the Denver metro region as well. And we have some, similar trends in current uses, where you can see that table at the bottom where most people do drive alone. We have about 5.9% of people using transit, 2.3% biking, and 1.7% walking. So as we looked at this, we really felt like we wanted to increase the use of those other modes and looking at our entire system in terms of how we can increase access and safety and increase the comfort of the use of all those other modes. So that was a real focus for us. Again, we have these current conditions that a lot of us are facing and the implications, and this of course was completed, prior to COVID-19. So we know that some of these conditions are going to be worsening in the future, and so we're going to obviously be keeping an eye on that. But decreasing housing affordability, meaning additional and increased in-commuting, more regional travel, equity and access and options, and transportation that can support long-term sustainability and economic goals. So I'm going to talk a little bit about the goals that we set forth in our Transportation Master Plan and our framework, and then some of the projects and recommendations. So we have 8 goals that we outlined, and I won't go into details of every single goal, but you can see that some of our key goals were really focused around the efficiency of our system and the safety of our system. We were really interested in increasing mobility options and access for people of all ages, abilities, and income level. And we also were looking at local and regional travel, and also environmental sustainability and community health. So those were kind of some of our key focus areas. I talked a little bit about the all ages and abilities, and again, this was a lens that we used throughout our entire process, and we continue to use as we're looking at projects as we evaluate them. We're looking at improving our system to prioritize safety and increase mobility options, support sustainability, and that also supports our businesses. And the table or the graph that you see to the right is really just kind of to provide some guidance in how we can look at the conditions of our current transportation network and how we want, how and what accommodations could be made. So in certain areas where we currently have, lower levels of traffic, in terms of volume, lower traffic speeds, what can we do? And then as those problems get worse or we have more concerns about higher traffic volume, some of the responses that we might find. So just as an overview of our plan and kind of how it's laid out, we have prioritized investments in specific corridors. So we've identified kind of our key corridors. So for those of you who, just to orient you to Louisville, kind of at the north end there, that main corridor that goes through from east to west is South Boulder Road. And South Boulder Road is one of our key corridors. From north to south on kind of the east end of town is State Highway 42. That's the CDOT highway that goes right through the city of Louisville. And then we have McCaslin, which is a large road that is kind of on the western side. And then to the south, you can see Dillon Road and US 36. So that kind of just orients you to the town. Within, we have Main Street, several neighborhoods, and some arterial corridors that we also were looking at, as well as neighborhood streets. We were really looking at our bike network and building on the trail system that we have, and also prioritizing areas for pedestrian improvements. Again, really wanting to improve the walkability of the city and the ability for residents within the city to be able to walk to key amenities and key resources, and also for people who work in the city to be able to reach those safely and easily as well. And then, of course, we wanted to prioritize enhanced local and regional transit options. So I talked a little bit about the primary corridors that we looked at. And State Highway 42 is one of those key corridors. And just as an example of what we're kind of looking at in terms of having amenities that support multimodal use and access by other users than vehicles, we are really looking at how we can enhance and include separated sidewalks and bikeways on State Highway 42, and are working with the city of Lafayette to look at the entire corridor all the way down from US 36 in Broomfield all the way north to Lafayette and State Highway 7. In terms of pedestrian improvements, again, we've highlighted a couple of areas. The blue, those are some of the key areas where we identified a real need to connect people better through pedestrian improvements. This is around schools, around key transit points, and also we looked at future redevelopment, and when redevelopment occurs, taking those opportunities to make structural and infrastructure improvements that would better accommodate pedestrians in those areas. And again, we also looked at our bike network, really closing the gaps on our trail network and on our bikeways on the roads, and upgrading existing facilities, and then improving crossings for bikes and pedestrians. Examples. As an example, I'll call out a project that the city that's underway right now, that the city is working on currently. Pine Street is kind of in the center of this map. It's that almost black looking kind of dark purple line, and it goes from Main Street to Via Appia right to where the Senior Center and Recreation Center are. So it's kind of a major east-west corridor, and we are making some improvements, sidewalk improvements to expand the sidewalks, also putting in buffered bike lanes and improving crossings at many of the intersections where we've previously made some improved intersection crossings, but some we didn't. So we're completing those. And we're really creating more of kind of a complete street element along Pine Street so that it's much more accessible and comfortable for people to use the different modes of transportation, again, to kind of travel east and west throughout the city. We're excited about that. That work is happening right now and is expected to be complete later on this summer. We also looked at transit and really interested in increasing service and providing service to more areas. We looked at some specific projects and programs that we could enhance. For example, our Flex Ride service and improving bus stops. We have been working with our local jurisdictions, Superior and Lafayette, with new Flex Ride service starting there, and also Broomfield, to identify opportunities to improve the service between jurisdictions, which we know is important to a lot of riders who live in Louisville and have services that they need to reach in other communities. And then we also include a lot of kind of policy changes that we'll be making at the city that kind of lay the future for planning, prioritization, and implementation. and reinforcing policies around some of these concepts that were identified in the Transportation Master Plan, so we can improve not only the infrastructure, but also our programming and transportation policies. So I will stop there and just give you a quick overview. So I already talked about the Pine Street improvements that are happening this year. We had a number of projects that were approved prior to COVID-19, and so they're moving forward. We have sidewalk improvements that are happening on the west side of State Highway 42, which are making some great connections. And then, as I mentioned, we're working on a State Highway 242 corridor plan with the City of Lafayette and with CDOT and Boulder County. And then on South Boulder Road, we received TIP funding to do pedestrian crossing improvements at numerous intersections on South Boulder Road. And this is really going to improve the safety for pedestrians crossing that road, which is a very busy road. So as we look forward, we have included in the Transportation Master Plan a large number of projects that we would like to see completed over the next 10 to 20 years. And, we will include likely some projects in our upcoming budget. We know that we'll have some budget impacts from COVID-19 and that will present some challenges in the implementation. But, this certainly has created a blueprint for us where as we're doing improvements, infrastructure improvements, we have much more of an eye to meeting these goals. And so I think it's been a great process for our community and a really great guiding document for us to ensure that we're paying attention to what some of these needs are of our community as our demographics change in the future. So I'm happy to answer any questions that anyone might have, and feel free to email me if you have questions.
Thank you so much, Megan. I think it's really great. I mean, I love to see the emphasis on access and mobility for everybody of all ages and abilities. So it's really great. And you did say that this was your first transportation plan, correct?
Correct. Yep. This was the first one that we've done. And again, we just approved it. It was in October. So it's pretty recent.
Yeah. Congratulations. Big lift.
Thank you.
Yeah.
Thank you.
Do we have any other questions for Megan before we wrap up here? Okay. So if you have any questions, go ahead and email Megan directly, or you can email me and I can email Megan as well. So we don't really have anything else on the agenda for today. It was a pretty ambitious agenda, and I think we'll definitely calibrate to the time that we need to be able to have everybody get involved online. Any recommendations that you all have on how we can be a little bit more engaging online would be really great. We are struggling, of course, as I mentioned earlier, the reach of the virtual meetings is better, as far as how many people we're getting involved. But I do feel like the quality of engagement and those connections that happen around the table are kind of missing. So if you have any suggestions on how we can do that, that would be really great. Our next meeting is June 8th, and we will be meeting virtually then as well. During that meeting, I had planned on talking about the strategic planning process. I don't know if we'll have the consultant on board by then, but we can review our strategic plan for this year and then just generally what the process is going to look like. And then it can be a little bit more interactive, I think, at the June meeting, so it won't be as many presentations. So I hope that will be useful for people, and I hope I've given everybody the resources to be able to feel comfortable engaging on Teams. I know it's intimidating to do this online, but hopefully as this goes on, we're all getting used to it. So does anybody have any questions before we log off? Okay, great. Don't hesitate to reach out, send me an email or meeting in the chat or in the chat meeting, chat thread. Thank you all, and I hope you have a wonderful day.